5 minutes for questions.
Thank you, Mr. Chair, and I thank all of our panel for being here. Last year, Republicans had a Healthy Future Task Force chaired by Representative Guthrie, and I was the chair of the modernization sub of that committee. We discussed artificial intelligence, innovative technology, wearable devices, and how rapidly we could advance both better treatment options and also prevention in healthcare through both personification or personalized drugs, medical devices, both internal and external, and would be able to prevent disease, save lives, and promote healthy behaviors. And an example of what you're talking about, I'm going to show my age and have a discussion when I was in medical school. So I was a nurse prior to being in medical school. I was in the military 24 years. We had a discussion, one of our evening discussions one night was with a cardiologist and a cardiothoracic surgeon at the University of Texas discussing whether or not Medicare should approve CABGs, coronary artery bypass surgery, and if we should even be doing them. The cardiothoracic surgeon said they extend life by 1 year and better quality of life. The cardiologist said it's only 1 year, we should not do it. Imagine. I was asked as a medical student what I thought of that, and I said if we can extend life 1 year and increase productivity, we should absolutely do it because it won't solely be for seniors. And think of all of the young people we have saved by coronary artery bypass surgery. That's what you all are talking about. That's the point you're trying to get across, that we can save lives, better treat chronic diseases, promote healthy behaviors, and prevent disease. So Congress needs to act to make sure Medicare beneficiaries have access to diagnostic tools, including those that detect cancer early. Dr. Acklog, given that seniors are 7 times more likely to get cancer than younger people, and whatever breakthroughs we have with seniors will also relate to younger people, what actions do you think Congress and CMS should consider to ensure seniors are getting their proper screenings?
Yeah, I'm glad again you focused on diagnostics because, as you note, being able to do, we know that early detection works. We know that in other cancers, and we know that in cancers that are where we have new approaches using molecular diagnostics to do so. So, you know, Congress and CMS just have to act and provide us with predictable pathways to take these really groundbreaking molecular diagnostic technologies and use them for this purpose.
And Dr. Brinton, you know, having been a trauma nurse and an operating room nurse, I have seen the advances. And when you talked about our transcatheter valve replacements, what an amazing thing. I have a brother who had open heart surgery at 2 years old for a patent foramina valley. When CMS repealed the MCIT rule, they indicated other devices outside of the breakthrough program may benefit from this TCET coverage pathway. But it appears that CMS ultimately narrowed the criteria more than the MCIT policy. How should policymakers think about the breakthrough designation as a proxy for truly innovative devices and technologies? And what other features or designations should Congress or CMS consider when providing a predictable coverage pathway to innovative technologies?
Thank you very much for the question. I hate to repeat myself, but I'm going to. I think that, you know, as our prioritization, you know, innovation overall, there's a lot of ways you can think about bringing new things, new products, new technologies to patients. But the prioritization needs to be life-saving technologies, large, unmet, significant clinical needs. It needs to be addressing, you know, not incremental needs, but very significant needs, and it needs to be addressing disparities of care. Those should be the top priorities. And whether you call that breakthrough status, whether you call it emerging technologies, or you label it something, the reality is we need to actually move the resources to where we can have the biggest effect on patients. And so my belief is that's in that order.
I'm going to thank you for that, and then I'm going to have a sidebar in response to one of our colleagues' comments on how we use real-world evidence. And I'll just give an example of that. The Doctors Caucus sent a letter to the FDA in 2021 talking about the duration of time between the COVID-19 vaccines and how the time should be expanded based upon real-world evidence. So when we're talking about real-world evidence, we're talking about not just randomized control studies, but all of that information that comes after a drug has been approved, whether it's here in the United States or abroad. Thank you so much for your testimonies. Mr. Chair, I yield back.